This is special COVID-19 coverage on Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal.
Hello and welcome to a very special edition of the Your Health podcast. This is already the 10th episode of our special COVID-19 coverage. Thanks as always for listening, subscribing, and sharing. I'm your host, Shaun McMahon. Over the last few weeks, we've heard stories of courage and dedication. We've learned about programs and services that continue to help the most vulnerable. Well, on today's episode, we head straight into the lion's den of the COVID-19 pandemic, the intensive care unit. Our special guest works with the most critically ill. He's the chief of the Division of Adult Critical Care Medicine at the Jewish General Hospital. Dr. Paul Warshawsky is on the line. Thanks for joining us.
It's my pleasure. Thank you for taking the time to talk to me.
Oh, it's a pleasure. Listen, Dr. Warshawsky, I'd imagine that on a normal day, the intensive care unit would be one of the most intense places in the entire hospital. What does it look like now that we're weeks into the pandemic? Have we peaked? Is the worst yet to come? Has there been any improvement? What's the status?
It's been a really unusual, bizarre, and strange experience. So intensive care beds at our hospital, as is the case with all hospitals in Quebec and probably almost all hospitals in North America, are always very limited. There is continuously more demand on our beds than we can fulfill comfortably on a daily basis. In a large part, that relates to a large volume of surgeries that require ICU care afterwards, and the only source of patients that we have any control over is those. So when the ICU capacity is exceeded, it results in cancellations of some very important surgeries like cardiac surgeries, and that's a battle that we would 6 weeks ago, 7 weeks ago, fight on a daily basis. Then, all of a sudden, we started throwing in volumes of patients with the same disease like we've never seen before.
So surreal. But I mean, by the same token, though, when the new ICU was put together a few years ago, based on the experience you had with H1N1, it seems to me that the JGH was more prepared for something like this and it had, contingency plans in place to adapt. So I'm just curious, when it all started to unfold, did you feel like it was under control? Like, what happened as it evolved?
So we started off in a situation where we were far ahead of what most hospitals were able to deal with. And in my mind, I thought we were going to have enough beds to take care of those patients. And within a couple of weeks, I realized that we were nowhere near that. So a few things happened. We immediately filled up. So of the ICU has 36 physical beds, but ordinarily 24 of them are open. So when we started getting these patients, we had 17 beds that were capable of negative pressure isolation. And I had sort of hoped that maybe we would be able to stop when those 17 beds were full. They filled up very quickly. What was unusual is that at the same time as those beds were filling up with the same disease, every single patient having the same disease, which again is just extremely unusual for us, because the hospital and the province had the foresight to start reducing some of our other activities, the patients that we usually were caring for, which to a large extent were surgical patients or patients admitted for other types of treatments, started to go down. So we actually, for the first little bit, had the total bed capacity to deal with these patients, but we started to struggle after about a couple of weeks of this. We then made a decision, as we had planned from the get-go, that the patients who were the least contagious would be moved from these negative pressure isolation rooms into the other rooms of the ICU, and we increased our nursing resources through heroic efforts that were made all across the hospital. We increased our respiratory therapy resources also through incredible work that was done in all of these areas so that we would be able to handle a total of 36 patients in the ICU. And then we realized that wasn't going to be enough either.
Unbelievable. It's like you're always swimming upstream in this constant battle against the logistics of it all to just readapt and readjust and reinvent the ICU on a daily basis, depending on whatever the situation's throwing at you on any given day. It's incredible. Where are we at, though, realistically in the curve? Like, where are patients coming from at the moment? Where's the area of concern?
So what we're seeing is that the number of cases from the community is leveled off. We're still seeing occasional cases from the community, but not the same volume that we were seeing at the beginning. But unfortunately, we're seeing a large volume of cases from the long-term care institutions. So we're certainly not out of the woods yet, But we are kind of right now in a zone where we certainly have the resources that we need to take care of people. And as long as we can be in a situation from an ICU point of view where we have those resources, we can continue to give people a good chance at survival, even if they land on a ventilator. But if we end up in the situation that New York got into, then the mortality rate is going to go up for those patients.
In closing, Dr. Warshawsky, I just want to ask you how you and your staff are doing, because, I can only imagine the last few weeks have been emotionally, mentally, physically draining and completely overwhelming at times, I'm sure. So how's everyone been able to cope with all of what's been going on?
I think there are a lot of positive things that people have seen in this. This has been an experience that all of us will remember for sure for the rest of our lives. I hope we never have to go through anything even remotely like this again. But what was absolutely amazing is the number of people who stepped up and said, what can I do more? What can I do more? What more can I do to help? And the staff that I work with in the intensive care unit, I say this every single day, but I say it now 2-3 times a day. I'm extremely blessed to work with the group of people that I work with in the intensive care unit. Every single person who works in that unit has been giving us 120% right from the get-go, and it's just been unbelievable. We were prepared. We had a plan. We were fortunate. We had the equipment that we needed to protect ourselves and to care for our patients. And we have been able to do some really incredible things. Seeing our patients go home, seeing our patients interviewed in the newspaper and going, I remember when he was in the intensive care unit on a ventilator. It's just incredible to see patients who were very, very sick, because these patients are very, very sick when they're in intensive care unit.
Well, they're getting a second lease on life because of what you and your team are doing in there. So thanks for everything you've done thus far, and best of luck going forward.
Thank you very much. And I just want to take an opportunity to thank you guys for all that you've done, but also just to remind people that the goal of this is to keep having enough intensive care unit beds to provide care for the sickest patients and enough hospital beds to provide care for the sickest patients. So please, everybody, protect yourselves. This is not over yet. And if we relax ourselves too early, we will have a second wave. And the resources of the province are in a delicate balance. So every patient who protects themselves is making space available for those patients who are most sick. So please, everybody in the community, to keep remembering, do all the things that you're being asked to do. Stay at home if you can stay at home. Expose yourself to the public as little as possible. Keep your distance as you're recommended to do, and stay safe, because keeping yourself safe is also saving somebody else's life.
Dr. Paul Warshawsky, Chief of the Division of Adult Critical Care Medicine at the Jewish General Hospital. Thanks again.
Thank you.
You've been listening to special COVID-19 coverage on Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal. Don't forget to subscribe at CIUSWestCentral.ca/podcast or on your favorite podcast platform.